Okay, our next speaker, Dr. J. Galvez. It won't be as exciting as that one perhaps, but it will be very interesting and very useful. So please welcome Dr. J. Galvez, one of the nation's foremost specialties in head and neck surgery, as well as ear, nose, and throat. Very important. So please welcome Dr. J.
I think one of the more common complaints that we see right now in the clinic is sore throat. Okay, so laymen or lay people would call it sore throat, but more commonly in the clinic, most of these people who come in for consultation who complain of sore throat are actually diagnosed of suffering from either pharyngitis, tonsillitis, laryngitis, okay, or all these itis things, suffixes that you hear from your doctors. It's basically a form of inflammation of the upper airway and the air passages, okay, food and air passages. So this is just a sagittal section of the oropharynx, or the area of the throat, okay? It's basically the area where the base of the tongue is located, okay? And basically it's that area wherein you see the tonsils when you open your mouth in the morning when you brush your teeth, and then you yourself would try to investigate your own oral cavity. It's that area wherein the base of the tongue commensurates with the tonsils laterally and superiorly with the pharynx, okay? And you see that uvula right there, that is the entire throat area, okay? So by definition, in layman's term again, we describe sore throat as either pain, scratchiness, or irritation of the throat area, okay? And usually this is accompanied by pain, or what we call as dysphagia, when you swallow, okay? This may be accompanied by fever, okay? And sometimes it is accompanied by lymphadenitis, or usually there's swelling of the lymph nodes in the neck area, okay? So this is actually the primary symptom of pharyngitis, the sore throat, okay? Sore throat is not an illness, but it is a symptom of a potential underlying disease, such as pharyngitis, okay? So actually, in the workplace, we see this as a very common occurrence. I think in the country, this is just second to acute ear infection. Okay, the complaint that we most commonly see are in children, and they're brought to us because of earache. Okay, and then secondly, most of the people who come to our clinic are usually patients who complain of sore throat, and eventually are diagnosed with pharyngitis or tonsillitis. Okay. So in terms of prevalence, okay, we have this study here in the Philippines conducted at the Philippine General Hospital that in about 1,000 patients, okay, seen at the outpatient department in 2005, there are at least 7 patients who were diagnosed as having acute tonsillitis, 3 patients diagnosed as having acute pharyngitis, 15 patients diagnosed as having a combination of both acute tonsillopharyngitis, and 56 patients diagnosed as having chronic hypertrophic tonsillitis. These are the patients who just come in, and the most common complaint is usually sore throat or difficulty in swallowing. And when you examine them, actually what you see are large, humongous tonsils. Okay, I'm sure you're familiar with those pharyngeal tonsils. Those are the 2 large structures that you see when you open your mouth. Okay, I think we have some diagram here. So again, researchers say that this is, again, one of the more common reasons why they visit their physician after an acute ear infection, okay, sore throat. Okay, and we can imagine the loss that we see here in terms of workload, etc., etc. But I'm sure this is not as bad compared to what we lose every day in traffic, okay? So, but again, you see the morbidity caused by laryngitis or pharyngitis, okay? So this takes a lot of our time, okay, off from work, okay? So again, the symptoms would depend. If the inflammation is commonly located in the tonsils, henceforth, the patients complain not just of sore throat, not just of scratchiness, but more commonly the pain in swallowing. When the inflammation now proceeds lower, okay, to the larynx or to the voice box, okay, what happens is that patients also complain of hoarseness, okay, or there is breathiness of voice, okay, that's hoarseness, or yung tinatawag nating pamamaos. This is very common, again, especially in BPOs, in call centers. We see this as a very common complaint, okay? And then sometimes patients, when they do not seek treatment, okay, they develop fever, they develop soreness in the neck area, okay? Some patients would even complain of headache, okay, and sometimes body malaise or fever, weakness. This could be a symptom or a sign of an underlying illness in the oral cavity, okay? Again, in anatomy, so you see those two things here to your left is the normal, okay, structure. That's how your throat looks like, okay? And on your far right, you actually see here the tonsils hypertrophied, or they are enlarged compared to the left side, okay? So we call this hypertrophied tonsils, or you have large tonsils, okay? So this could be a cause of sore throat. Another thing is that you have exudates. Since the tonsils are cryptid, okay, they are potential for a nidus of infection. Okay, so a lot of food stuff get entangled in those crypts, and they stay there for a long time, and they invite bacteria, in viruses and fungi as well. Henceforth, they become inflamed. Okay, they become red. Okay, so you now see the signs of inflammation going on right there. Okay, at the same time, the entire pharyngeal apparatus, or the roof of your throat, becomes red as well. Hence, you have pharyngitis. Okay, if your tonsils are red and inflamed, it's tonsillitis per se. But if the pharynx, okay, or the roof of the throat is inflamed, we call it pharyngitis. If there's an inflammation of both structures, we call it tonsillopharyngitis. If it's acute, if the symptoms are between 7 to 10 days, and if it's chronic or lingering, if it lasts for more than 2 weeks. Okay. So other signs and symptoms may be related to other problems. There are some patients who come to us and they say it's sore throat, but actually it's not. It's postnasal drip. Patients actually have chronic allergic rhinitis. Okay, they have untreated allergic rhinitis, and they have sinusitis per se. Okay, hence the discharge goes back to the throat. Okay, because that is the normal pathway, and they go down the throat. Okay, so this is postnasal drip. There's this tendency to clear the throat more often. Okay, so when you examine the mouth, it's perfectly normal. But when you examine the nasal cavity and you do some ancillary procedures such as an X-ray, you see there diseases or inflammation of the sinuses. Hence, you have sinusitis. Okay, this could be a sequela of an allergic rhinitis. So it's usually postnasal drip. You get what I'm saying? It's not throat itchiness per se, but patients complain of that fluid dripping at the back of the nose, okay, into the mouth. Okay, so you just don't diagnose yourself with pharyngitis or laryngitis. You could have sinusitis, okay, masquerading as an acute pharyngitis. Okay, some patients, they also complain of sneezing. Okay, these are the patients who have allergic component. Okay, they were born with this. This is hereditary. There is sneezing. And one of the cardinal features of an allergy is itchiness. Okay, if you have throat itchiness, doesn't go away. Okay, it comes back, goes away, and it comes back again. It could be an allergic form of rhinitis or pharyngitis. Okay, hence you have to take the necessary medications to control the allergies, to alleviate the symptom. Okay, and then you have nausea, you have vomiting. This could be a more advanced case. Okay, if it's untreated, okay, then it becomes a bacterial infection. It goes systemic. Hence, you have the fever, you have the chills, etc., etc. One of the more common causes of sore throat or pharyngitis and tonsillitis is your viral infections. It's basically something you get, okay, wherever you go. There's a high risk that you're getting it in places that is crowded, such as this place, okay, dormitories, okay, in school. That's why your kids, okay, they're sent home because they have the common cold, okay, they have the sore throat. It's because, you know, it's very common in congested environment, okay? Because the tendency for these viruses to spread is either via droplet or either via airborne, okay? You understand? Airborne component. So it's very easy to get these viruses, okay? Actually, your rhinoviruses, your parainfluenza viruses, the viruses that cause the common cold and the sore throat, are basically the most infectious or contagious of all the viruses. You understand that? That's why if you have a family member with a sore throat or a cold, chances are everybody else will catch it if it's caused by a virus, okay? But if not, if it's just one person who has it, chances are it's not a viral infection. It could be an allergic component. Remember that. You cannot transmit allergies, but you can transmit the viruses. Okay. As I mentioned a while ago, there are other causes as well. Okay, allergies and sometimes changes in humidity. So it's either very hot or very cold. Okay, if it's very hot or very cold, these are conditions wherein the humidity is very high. Okay, henceforth, there is not enough lubrication of the oral cavity. Okay, hence we are prone to throat dryness. First, you feel that you have difficulty swallowing, it's because you're getting dehydrated. Okay, and then since you have dryness, eventually you don't realize that, okay, there is now the tendency for opportunistic viruses and bacteria and fungi to dwell, okay, in your oral cavity. Okay, and they could be a potential cause of the pharyngitis or tonsillitis. Again, irritants such as smoke. Cigarette smoke is one of the more common irritants. We don't realize that, okay? Not only is first-hand smoke, I'm sure you know what first-hand smoking is, second-hand smoke as well, and there's what we call now as third-hand smoke. Okay, it's actually the residues of smoke, okay, which sticks to the curtain, okay, to the floors, and to the walls, okay? They do have a detrimental effect as well to individuals, especially the children. Okay, so if you want to smoke, you go away. Okay, if you don't want your colleague or your family members to be, aggravated with your smoking, you make sure you smoke in an area wherein you mingle with smokers as well. Okay, and then you don't want to smoke in an enclosed environment such as your lanai or balcony, because smoke can actually stick to the walls, to the furniture. Okay, and they could stay there for a longer period of time. Okay, of course, GRD is very common as well. So we see patients who come in with sore throat, throat clearing, and then everything is clear. And then we do some other tests. We do endoscopy. We realize that these patients have GRD, or the gastroesophageal reflux. So when your doctors tell you have reflux disease, it's basically your acid, okay, inadvertently going up your throat. So the acid in your stomach is in a place wherein it is not native, okay? So basically you have irritation, because gastric acid should only be in your stomach. It shouldn't be elsewhere. It shouldn't be in your esophagus. It shouldn't be in your throat. But usually happens, very common that we see right now, reflux, okay? This is usually due to habit. This is usually due to excessive eating at night, alcohol, consumption, smoking, stress, etc., etc. Okay, lifestyle as well. These are the main causes of GRD. And one of the main symptoms is, again, sore throat or throat itchiness. So you have to see your doctor if this persists. Okay, if you take medications on your own, it still persists for more than 2 to 4 weeks, I think it's the proper time for you to seek consultation with your physician. Okay, again, we see this a lot in adolescents, children aged 7, 8 to 12 years old, because this is the time that the tonsils and their adenoids, okay, these are the lymphoid tissues, start to grow. Okay, that's why it's very common that we see elementary, primary school age children being brought to the hospital or to the clinics due to either ear infection or sore throat. Okay, again, people who are exposed to tobacco smoke and other inhalational pollutants such as dust, animal dander. So those of you who have pets at home, you also have to be very careful. Okay, chemical irritants, okay, in the workplace, factory workers, okay, and patients who have frequent sinus infections as well. So let's go to the treatment, a few more slides, okay. It's very important to understand the pathology. As a physician, what we do is, of course, we need to see the patients, okay. But with social media right now, a lot of patients, they seek consultation using either Viber, using either FaceTime, so which is actually good. But on one end, it's disadvantageous to the patient because we need to see every nook and crevice of the nose, throat, and the hypopharynx. And the only way we can do that is by doing an ample physical examination. And physical examination would range from either direct examination of the throat, or what we have right now, we have those tiny telescopes that we insinuate into the nasal cavity and into the pharynx, and then we get a good glimpse of the throat area, okay, the pharynx, the hypopharynx, and everything. So more or less, for a physician, it gives us a clear perspective of what is actually happening inside, okay? Other treatments, of course, very important, is home and lifestyle remedies. Increase your body fluid intake. take more than 8 to 10 glasses a day since you are dehydrated. You want to boost your immune system. So the only way to do that is you rest. And then gargling is very important. Okay, just take lukewarm water, 1 glass of about 200 ml or 8 ounces. Just put a half teaspoon or 1 teaspoon of salt and you gargle. And you have to humidify yourself as well. If you're always in an air-conditioned room, mind you, you have to go out as well. You have to condition yourself. Don't get used to an air-conditioned environment. Okay? So it allows you now to breathe fresher air. Do not be too dependent on the air that is in your room, because that is not the healthiest. It's just the air inside there. Everybody's, carbon dioxide and everybody's viruses are being, circulated in the room. So get a breath of fresh air. And of course, the best thing here is to practice good hygiene. Okay, brush your teeth 3 times a day. Wash your hands as frequent as possible. Okay, use alcohol and sanitizing agents. Okay, to sanitize yourself. And it usually should be a habit for you to gargle as well. After brushing your teeth, try to gargle, okay, with antiseptic, okay, or an antibacterial ingredient. In other tips, again, wear mask, quit smoking. If you're in the workplace, you know you have inhalational pollutants. You should wear the necessary gear or mask. Okay, stay indoors. But again, as I mentioned, you have to stay outdoors if necessary as well. And avoid exposure to secondhand smoke. If you're smoking, quit while you have time, okay? And again, if symptoms persist, insult your doctor. Thank you.